is not all the same. It moves along a spectrum. From mild clogged pores, they're easy to treat, to deep, painful lesions that can scar. The key is knowing where you are on that spectrum. In today's video, I am going to help you understand the different kinds of acne from the mildest form and work our way up to the more severe forms. They're harder to treat. Hi, I'm Dr. Morgana Colombo, Board Certified Dermatologist and founder of Vida Derma, a skincare line for mature skin. The least severe type of acne is the blackhead, also called an opened comedone. A blackhead forms when a hair follicle gets clogged with oil or sebum, dead skin cells, and bacteria. The pore stays open at the surface. Because the material inside is exposed to air, it reacts with oxygen and turns dark. So the black color is not dirt, it's oxidized melanin and lipids. Blackheads are not red or painful, they are non-inflammatory. That means your immune system has not strongly reacted. These are usually the easiest to treat. Gentle exfoliation, retinoids, and oil control can help clear them. So what if the pore closes? A whitehead is called a closed comedone. It forms the same way as a blackhead. Oil and dead skin clog the follicle. The difference is the opening is closed or very narrow. So because air cannot reach the material inside, it stays white or skin colored instead of turning black. Whiteheads are still considered mild acne. However, they're slightly more unpredictable. Since the trapped material cannot escape easily, pressure can build up. If the follicle wall breaks under the skin, inflammation begins. Hormones often play a role here. When androgen levels rise during puberty, menstrual cycles, pregnancy, or stress, oil production increases. More oil means more clogged pores. Many people notice more whiteheads around the chin and jawline before their period. So far we're in the easy to treat category. But what happens when redness appears? Now let's move into inflammatory acne. So a papule is a small red raised bump without pus. It forms when bacteria inside the clogged pore trigger your immune system, and your immune cells then rush to the area. They release inflammatory signals. The skin turns red and tender. This is your body trying to fight what it sees as a threat. Papules are more serious than blackheads or whiteheads, but they are still considered easy to treat and moderate acne. Topical prescriptions work well here. If inflammation continues, the papule can become a pustule. A pustule looks like a red bump with a yellow or white center. That center is pus, and it's made of white blood cells, bacteria, and debris. The difference between a papule and a pustule is simply the visible pus at the surface, but both represent an active immune response. Hormonal acne often appears at this stage. Many adults, especially women, develop red papules and pustules along the lower face before their menstrual cycle. The root trigger is increased oil production driven by hormones. These lesions are treatable, but picking or squeezing them can push inflammation deeper and increase the risk of scarring. And now we reach the turning point. There is some acne that can be deep and painful. A nodule is where acne becomes more serious. Nodules are large, firm, painful lumps that extend deep into the dermis. They're usually larger than 5 millimeters, about the size of a pencil eraser or bigger. The inflammation here is intense. Sometimes the follicle wall ruptures completely, allowing inflammation to spread into surrounding tissue. Nodules are much harder to treat. Over-the-counter products usually are not enough. Because they sit deep into the skin, they carry a much higher risk of permanent scarring. Hormonal acne frequently shows up as deep nodules along the chin and jawline in adult women. These breakouts often feel tender and persistent. But even nodules are not the most severe form of acne. Nodular cystic acne is severe inflammatory acne dominated by large nodules and cyst-like lesions. These bumps, they're going to feel soft or fluctuant as if they contain fluid. Even though they're called cysts, they're not true cysts under a microscope. They are severely inflamed nodules filled with pus and debris. This type of acne often affects the face, chest, back. It's painful and frequently leads to scarring without strong medical treatment. Prescription medications that reduce oil production and calm inflammation are usually required. So acne starts with oil. Hormones often drive that oil production. From there, pores clog, bacteria grows, inflammation follows, and some people stop at blackheads, others progress to painful nodules. The earlier you treat acne, especially before it becomes deep and inflamed, the easier it is to control and to lower your risk of scars. So what questions do you have about your skin? Drop them in the comments below and I will do my best to answer them in a future video. Remember to hit like and subscribe, and I will see you in the next one.